Jeffrey, welcome to Promis. Delighted to see you. I was fascinated by your book because I'm a traditionally trained doctor. You know, I learned at medical school that the brain is made, and that's it. And you're telling me that it goes on making itself.
Well, I mean, this is the big point. Scientifically, we were in a position where essentially the entire paradigm of the earlier days was no longer sufficient to explain the data that was coming through in terms of brain responding to changes in environment and brain being able to adapt to changes in environment. And so in the animal literature, there was already a very significant body of work that was showing that enriched environments led to increased synaptic development, increased neuronal proliferation, and so on. What we wanted to add, which is particularly relevant to your work, is that the mind as a attention-directing vehicle could make this plasticity self-directed.
Right. I was fascinated by the illustration you quoted about London taxi drivers.
Yes.
Tell us about that.
Well, that has become a very famous study which shows that the hippocampus, which is the part of the temporal lobe, which in the medial part of the temporal lobe of the brain, which sits essentially right above the ears, and the middle part of that structure, the so-called hippocampal gyrus, has been known for a long time to subserve long-term memory function. What they discovered was that because of the incredible memory development that London taxi cab drivers accomplished in learning the incredible intricacies of the London road map, that the London taxi cab drivers had enhanced development in that area of the brain that you could actually observe on enlarged and enhanced development within.
So it grows larger when they're doing that work?
It does grow larger, but the thing that I think is more important than just size per se is internal development. Right. The development of connections.
And when they retire?
No, that study hasn't been done. But I would say, based on my own experience, it's important that they, shall we say, direct those skills to other avenues, because just as it can be developed, it can regress. And so the whole notion now becomes continued development,
yes.
And but that also has to be an impetus to one to not become complacent.
You may ask why a director of a treatment centre would be interested in London taxi drivers. Well, my answer to that is that if we can show that the brain has the capacity to change, it's not just a box that's created and that's it, then the medical model is wrong. Because the only armament that I was given as a medical student, as a junior doctor, was drugs. You know, I've got to drug people. If they're depressed, I have to give them an antidepressant. If they've got, bipolar disorder, I have to give them lithium. Well, I think in the case of lithium, it's probably true. But there are people, well-respected physicians, Dr. William Glasser, for one, is a psychiatrist from Los Angeles who created choice theory, and he's been here. He wouldn't prescribe lithium. He says it's unnecessary, people get better. He wouldn't prescribe neuroleptic drugs either.
Well, I think actually, I've given a lot of thought to this subject since my entire early academic career was in the area of neuropharmacology. So I'm very much a product of that culture to some degree, although I have certainly, to a very significant degree, changed course. But I would say that if one understands the use of these pharmacologic agents as tools to enhance a person's capacity to direct their attention more effectively and so rewire their own brain, one then no longer has to have such a, as it were, symbolic sense of, I won't use them, I do use them. They no longer become so central to the treatment paradigm and just become one additional help And the key issue is pharmaceutical agents should be used to help people help themselves.
I totally agree. I don't think there's anything to be gained from an adversarial relationship among doctors. We need to respect each other. People didn't come into medicine in order to make people worse, they came in to try to help people to get better. Right. There are different ways of helping people to get better. My particular slant in addiction is that I don't think drugs help people to get better. Whether it's a legal drug or an illegal drug, I think is irrelevant. I think that the reason your work fascinates me so much is that it gives the backup to the behavioural methods of changing. If taxi drivers can change the shape of their hippocampi through the nature of their work, why shouldn't alcoholics do so through the nature of their commitment to Alcoholics Anonymous?
Well, I'm essentially certain that they do. I mean, these are all just things that could be studied and at a certain point will be studied. Where it has been studied and definitively demonstrated is in stroke therapy, in the therapy of patients who have had cerebral infarctions. Yeah. And so parts of their brain have died. Yeah. And as I say, this is not a Lazarus effect. We're not taking the dead and bringing it back. What it is, though, is a rewiring effect that takes brain tissue, which previously was dedicated to other tasks, and helps to incorporate the use of that tissue into new tasks. So in that way, it is an extremely powerful demonstration that the brain is available to be used for what your focused attention and effort wire it to be used for.
I was watching a presentation by Dr. Richard Bandler, who, as you know, created neurolinguistic programming, NLP, and he was talking about a patient who'd had a Broca's area stroke. Correct. Now, the Broca's area is a speech therapy, and so this chap had lost that side of his brain that had the Broca's area, and so he would produce word salad. And what Dr. Bandler had helped him to do was to use the other side of his brain that actually contains the melody making. But instead of getting the chap to sing Three Blind Mice, he got him to sing, "I'd like to open the newspaper." And so he was able to communicate through melody what he couldn't do with
in fact, these studies have been done in Germany at major medical centers. Cornelius Weiler and another woman, Dr. Maria Cristana Musso, published a series of studies using brain imaging in which they showed that patients who had severe Wernicke's area strokes, which impaired their capacity to understand language, through the use of training, of essentially rehabilitation in understanding language training, they systematically showed that as the training progressed, there was an increased activation of, in fact, the other side of the brain that was essentially having the right brain take over for the left brain that had been infarcted. So you could bring into play, through training with effort, the entire other side of the brain in the analogous area and disinhibit, which will in fact activate it to do things that it had never done before.
So just as at this minute, one hopes that Andy Murray is out there on the practice court, learning how to win at Flushing Meadows next time round.
Exactly.
You know, so that there it is, as a professional tennis player, grooving.
Well, exactly.
And what you're saying is, we can do the same with our brains.
He's doing it with his brain.
He's doing it with
He is absolutely doing that with his brain. He's absolutely doing it with his brain. So, what he's doing is creating circuitry, essentially, certainly in the basal ganglia, the automatic transmission area of the brain, which will enable him to use these finesse strokes without having to think about it in competition. And he just releases it,
and away it goes.